I'm Netra Halperin, and welcome to Netra's News. We have a very exciting show tonight about a very serious topic, which is healthcare. And I've got some experts in the studio tonight. I have Thomas P. Huber, who is just recently was the Managing Director of Strategy for Kaiser Permanente. And I've got Tony Krieg, someone I'm sure you all know, who is the CEO of Hale Makua. So, Thomas, can you please tell us, what does a Managing Director of Strategy do?
Yeah, a Managing Director of Strategy tries to focus on quality, service, safety, and affordability in large healthcare systems.
Okay.
So one of my responsibilities for a group of 25 people was to really do care coordination and work across the entire system, so working with nurses and doctors and medical assistants to try to improve the quality, service, and safety of our healthcare system, and to run large programs aimed at doing those four things. Again, improving the quality for our members, the safety for both our workers as well as our members, and affordability and the cost.
Okay, well, that's an important thing, so I'm glad you were on the job here. And Tony, what does Hale Makua, if you could tell the audience, what does Hale Makua do? Health systems.
Yeah, so Hale Makua is about 60 years old. It's what I term as a post-acute provider of services. Okay. So we have 2 nursing homes, Medicare certified home health agency. We case manage families who care for people who otherwise would be in the nursing home. Okay. And we have a day health center where people come during the day who otherwise would be in the nursing home and are supported there and go home in the evening. We also have a rehabilitation center, so we're bringing people from the hospital for short-term rehabilitation, and then we send them home.
So it sounds like you have a lot of levels of care, and especially, for instance, where you're doing the case management of the families, it's like that bridge. So the family's not completely, you know, out on their own, and then the patient doesn't have to get a higher level of care. So that sounds like you've got a lot of stepping, a lot of structured stepping.
Well, there's 2 things. There's the people who go back to their family, but then there are these surrogate families, these foster families, who are actually creating a business by adopting 2 or 3 elders into their home. And otherwise they'd be in the nursing home. So it's a cost-effective way for people to provide care, and then people don't have to be in an institution.
Right, absolutely. Well, that's great. So the question I want to ask both you gentlemen is, what is working in our healthcare system? And you just came here from the mainland, so you're gonna, you have a global approach, and you're here, and of course I'm sure you have a global opinion. What is working in our system and what is not? And then what would be your suggestions?
Well, you know, I'm going to come at this from the fact that I've just finished being a member of the Hawaii State Long-Term Care Commission, which was charged by the legislature to study the long-term care system in Hawaii and offer some recommendations. And so I'm going to read a paragraph in the executive summary, which is pretty sobering. And the problem of long-term care is that the long-term care system in Hawaii is broken. It's expensive, it's beyond the financial reach of most people. Medicare and private health insurance don't cover long-term care, and few people have private long-term care insurance. As a result, if they need extensive long-term care, they must pay out of their pocket, and if their resources have been depleted, they must turn to the means-tested Medicaid program. More importantly, the aging of the population guarantees that there will be a much greater need for long-term care in the future. Between 2007 and 2030, the population over age 85 and older is expected, which has the greatest need for long-term care, will increase by almost 2/3. And there's no way to provide services for this population without additional sources of financing. But government can't do it all. So with that kind of dire kind of look at things, our community, meaning our state, is, you know, we have one of the fastest growing populations over age 85 in the country. And so we're really faced with some dilemma in terms of how to support families and support people who are aging and will need more and more health resources. So I guess one of the things I want to do is to encourage people to, if they're on the internet, which I know a lot of your viewers are, to look up the Hawaii Long-Term Care Commission and look at the report and look at the recommendations, which I know we won't have time to go into, but I think there are some really useful things for people to think about, and that's what I wanted to say.
That's awesome. And of those people, the increasing population of people over 85, what percentage would you say is people that grew up and live here, and what percentage are people who come here to retire?
Well, I don't really know the answer to that, but I do know that I think the population that was born and raised here over age 85 is growing fast, and it's growing faster than a lot of communities on the mainland.
Okay.
So it's not because we've had in-migration of those folks. In fact, in our experience, people who come to retire here and start to have issues with their health, I think a lot of them move back because as they become frail, they don't really have families, and so they move back with family. That's not true of everybody. So I think the answer really is that the population growing over age 85 is people who've lived here for quite some time at least.
Mostly. And of course, we'll see that the exception is Kalama Heights, and we'll show a video about that later. So, okay, Thomas, what is your comments?
So in terms of, let me start with what I think is not working nationally. I think I think the dialogue is broken. I think others would say that the healthcare system as a whole is broken. I don't know the answer to that, but I do know that the dialogue or the communication is broken, and I think that it's super important that we as a nation start to be able to have a generative or a dialogue about what it means to deliver high quality care, what it means to grow old and have a good quality of life. And I think currently the system is with accountable care coming, with new mandates coming, I think we're not yet in a position where that dialogue seems very, again, generative or good.
Okay.
I think in terms of our public system, I think a lot of our healthcare, in terms of the changes towards accountable care, will put increased pressure on our frontline clinicians, so our frontline care providers like doctors and nurses and medical assistants. And I think that's precisely what they don't need. I think what our frontline care providers need is space and time that allows them to do the caring that they went to school for. And so having a dialogue about that is important.
Excuse me. Could you explain to the audience what accountable care is?
So I can give you my perspective, and I'll preface it by that. But in terms of accountable care, I think for a long time in this country, we focused on care delivery, and the dialogue was around just cost of care. So accountable care says that as a whole system, we not only want to think about healthcare delivery in terms of cost or affordability, but also in terms of the kind of quality we deliver, the kind of service we deliver, and how safe it is. So previously, Medicaid and Medicare services would provide payments based on a population of patients at a certain number. Now they're going to be saying, depending on how well you take care of our people, we will reimburse you. So over time, the accountable care makes health systems more accountable in terms of quality, service, and safety. And it starts off initially as a carrot, and then after a while becomes a stick. And that, again, I think, again, as a personal, as a citizen, as a member of the healthcare community, I think it makes sense to be able to improve quality, service, and safety But I'm concerned that the kind of pressure on the healthcare system that's already quite tangible will increase with that. And again, my belief is we need to have dialogue like we're doing here and other places, need to have that dialogue to get to be a better healthcare systems. Because as we all know, or as I think many of us know working in healthcare, I believe we're currently worldwide at about number 32.
Ooh, that's embarrassing.
And we spend, I believe, upwards of 16% of our GDP on healthcare. And for that amount of spending, we should be able to have higher quality and higher service and more safer care.
And our GDP, our percentage of GDP compares to other countries, how?
So for the European nations, they spend about 6 to 7%.
Okay.
So a much smaller percent and tend to have much better outcomes.
Okay. You know, it's interesting when you were talking about the accountable care, it reminded me of No Child Left Behind, i.e. so jumping to another whole field, i.e. education. And what I'm seeing increasingly is if you look at both these systems, the healthcare system and the education system, there's background policy, there's overarching policy in both of them, which in my opinion in both of them is off, is not correct, and not a good model. And instead of looking at that, all the onus goes on to the teacher, the doctor, you know, the people at the front line. And I know with teachers, basically what I've been told is that the young teachers quit and the older teachers stay just to get their retirement. And it's because the whole paradigm of providing education, or I don't know as much yet about providing care, is not correct, and it's stressing teachers out, and that's stressing children out, and it's just not a good thing. So it sounds the same. Like, I guess I'll say more clearly what I'm saying is I think the problem is, and they talk about this in the Kalama Heights video, is the whole model of it's all a business. And it's all for profit. And yes, doctors and nurses, everybody should make a living. People should make a living. But I think there's like the insurance companies make about 30% of our healthcare dollar. And, you know, I'm not interested in subsidizing their businesses for my healthcare. And so I think that's where the problem is. And so instead of focusing on the structure and the whole paradigm, they're making things harder for doctors, and that's exactly what you're saying. They don't need more pressure on them. Right. The doctors that I've talked to are just as unhappy with the system as the teachers.
Yeah, no, absolutely. I think that in terms of, so that's what's not working. I think what we are seeing work in some systems, and I think Kaiser is a good example, but there's many other systems that are doing better, are where much of healthcare is unionized. I'm not as familiar with what's happening in Hawaii, but much of the mainland is unionized. And so as part of the positive trend we're starting to see is a better dialogue. And for example, Kaiser has a labor management partnership, and their entire focus is on improving the lives of frontline care providers. So they have organized themselves in unit-based teams. So there's currently over 100,000 people working in unit-based teams, and so collaborating and both labor and management working together in order to create a better environment, a safer environment for our healthcare workers, so they can provide better care for our members and patients. And I think that's part of sort of the positive trend that again, it creates the dialogue. And it doesn't speak to your point about the insurance, which I think is, again, it's a big piece of the puzzle. You know, so, but I think part of the positive trend is that in bits and pieces, we're starting to see the dialogue, and we're starting to see the support for our frontline clinicians. I think I mentioned to you when we talked before the show, I've been doing this work for about 15 years, and one of the great privileges of working in healthcare is to work and talk with our frontline care providers, to walk through the halls of the hospital and our teams and see how passionate they are about delivering great care. And so my sense is that whatever we can do to help improve their lives is the right thing to do.
And I agree with you, and that is what I've heard from, I was just talking to a social worker that works at the hospital yesterday, and she said that that is the #1 problem, is lack of communication between labor and management and between the people, and nobody's winning. Nobody's winning, you know, and that's, yeah, communication is the key. So what do you think, Tony?
So on that theme, I want everybody to know that the hospital administration and Hale Makua Health Service Administration and KULA have been working together for the last year. We introduced legislation in the last legislature to try to create a more coordinated system between all of the facilities, and I think pretty soon we'll be able to announce that Hale Makua and Maui Memorial and KULA will all become affiliated, so that we can work together to coordinate care better, to share best practices, and work on how can we become beneficiaries of what these accountable care carrots are going to be. One example of what accountable care is moving towards is that if people who are admitted to the hospital and go to one of our facilities, KULA, or even in the community, and they go back to the hospital within 30 days, the hospital is going to be financially penalized. In fact, they may lose the reimbursement they got in the first place. So that's a carrot, and that's more of a stick. But it requires everybody who's in the care chain to figure out better ways of communicating and making sure that people get the care they need when they leave, and that they have the information before they leave that's given to those of us who are downstream, so to speak. So that's an example of accountable care, as opposed to just in the not the old days, but currently actually we're being paid. If we bring somebody into the nursing home, into our rehab program, we're being paid for an episode of care. The hospital is paid for an episode of care. Those two payment systems are not they're not integrated. But more and more of that payment, the federal government is saying, if we're paying, our insurance companies are saying, if we're paying, we want to make sure that the outcome all through the system is a good outcome, and you need to show us what you're doing to make sure that people are getting the care they need, not just for the time that you have people. So I think that's a good thing, and there's more work for us to hammer out, but I think that Wes Lowe at the hospital and myself are going to be able to talk to the community about this in more detail in the near future.
That's awesome. And another thing that I think is really tied into this is healthcare itself, and another statistic that I wanted to point out is that many of the medical schools are funded by the drug companies. And so the system of medicine that we have in this country is very much focused on drugs. And drugs have a place, obviously, and surgery has a place. But I think we've strayed too far and very little attention is paid to diet. And for instance, if you had an auto mechanic school, they would not skip, fuel. Fuel is a part of any engine and how it runs. And so I think if we're going to hold all of these systems accountable, we need to change the diet expectations of what people are eating. And for instance, I've been a substitute teacher, and we did a unit on health on food, and then we go to the cafeteria and they feed everybody junk. And then the other thing is all of the toxins in our environment, and those are, I think, adding to our cancers. And so healthcare isn't this just sort of thing out there. There's there's diet, there's and then also that the schools took PE out, and that's the younger children. But what I'm saying is there's so much of our society that's anti-health, and to truly hold these systems accountable for health, we need to bring all of those things into alignment. And again, it goes back to money, that people are making money off of how things are, and we need to look at that and put health as a top priority over more corporate bottom lines.
Yeah, I guess in some ways what we've been talking about is the medical treatment system as opposed to the healthcare system broadly defined. Yeah.
Yeah, and that's an excellent point. And that's sort of like, well, if we got the War Department, but do we have the Peace Department? You know, so a health. And what would each of you gentlemen do if you kind of ruled the world or the country, as far as making it a more healthy environment for children as they grow up and gain habits and lives that people live?
Well, I think health education in the schools, but you're right. If there's a real disconnect, if you have soda pop machines in the schools and you're feeding them French fries and a lot of carbohydrates and not a balanced diet, I think our First Lady is doing a great deal in terms of diet and exercise. So yeah, I think the community we have to start in the schools and then really act. We have to walk the talk in terms of
exactly.
Yeah.
And that's one of the things that's impressed me about certain PPOs is that they have a vested interest in people staying healthy. So that workplaces that have those, they will provide exercise, programs or whatever incentives they can do. But it's kind of like back to the 50s when they had cigarette smoking. We finally banned cigarette commercials, and so that's how we got rid of them. And the system, if you start, there's a movie called Food, Inc. It's really great. It talks about how our whole system of subsidizing beef, and it's really complex, but the system actually creates a lot of the problem. The government is actually creating a lot of the health problems through which types of products, corn, GMOs, which type of products it's subsidizing, and that's part of the problem. So it's not just, the government should stay out of it and the health side. Well, the government should also stay out of it on the making the problem side. Because if you look at our country, you talked about Europe before. You talked about Europe before. People's diet in Europe is better.
Right.
And why would you say, why overarchingly, why do Europeans have a better diet than Americans?
Well, so I'm originally Swiss. I'm Swiss American.
Okay.
And it's interesting. I grew up for the first 12 years of my life in Switzerland as a Swiss citizen. And growing up there, even though I lived close to Zurich, we essentially almost lived on a farm outside of Zurich, and the kind of food that we ate, I think, was healthier. So growing up, the Swiss are famous for their muesli in the morning.
Right,
so so the idea of starting off breakfast with a healthy way as opposed to cereal. I didn't start eating cereal until I came to the U.S. And then, of course, as a 12-year-old kid, I think I found IHOP and McDonald's and all these other fast foods. And one of the sad things I learned during my master's program in healthcare was that other folks from outside of the U.S. that immigrate to the United States, actually their health outcomes tend to be worse than where they're from. Right,
yeah.
So because of part, I think because of the diet,
right.
And I think that's having healthier food, and it is the availability of it. I think that's one piece, but I also think we've been in this country. We've been on a how do we, get past the junk food. We've kind of gone down that road. It's almost like the war on drugs. We've gone down these paths, and these are really challenging issues and really important issues. But I also wonder if we can't sort of head on improve the junk food war. Then how can we make it more fun, better, more interesting to actually have fast food, healthy food? And I think we're starting to see some of that. I think you're starting to see some of the, instead of Red Bull, there's really cool energy drinks that are all natural.
Right.
And I think we're starting to see a sort of shift, and my sense is we have to compete with the products that are already available. In other words, if we can get to kids, and instead of hanging out at McDonald's, you can hang out at a organic store, and that's a cool place to be.
Right.
I think we're going to be engendering the kind of shift that we all want.
Yeah.
So
Yeah, and in that movie, Super Size Me, did you see that one? Did you
I
see
did.
that one? Yeah, and that one they talk about how McDonald's, of course, is excellent advertiser and imprinting. They imprint. They get these little kids and they give them toys and they have all these fun things and they just create fun in their mind associated with fast food. And it's very, and to compete, then we need the advertising budgets. But I think you hit on a good point, what is cool. And I think for here, a lot of the kids, that's considered, you know, oh, that's what hippies eat. Oh, that's not cool. And so there's not an interest in eating healthy food because it's not considered cool.
Yeah, I mean, my sense is that if we can make health food more fun, more exciting, and again, cooler, especially for kids, cooler, and we can earlier get, especially in our school system or box lunches, things like this,
Yes, exactly.
then we have a much better chance of sort of fighting that particular war. I think the second piece is certainly exercise.
Absolutely.
And you know, I don't know about Hawaii, but living in California, one of the nice things is that naturally we have exercise, and I think like here, in the ocean, there's an ability to use the water, and in the wintertime the mountains, and I think that all of those of us who try to go to the gym, I think it's hard to go to the gym and get your workout that way. But if we can get folks excited about nature again, whether it's the parks or the oceans, and again make that a cool place to be, I think that we would be doing, we would be better off.
Right.
Yeah, I agree.
And back to one of my favorite programs to criticize is No Child Left Behind, and basically they cut out PE.
Right.
And what the teachers have told me is that because of the time required to teach and coach the kids to take these tests, they have had to cut out PE, and they've had to cut out physical activity, and then also now the schools are all being starved financially, and some of the schools are managed, like I know Kihei School is just really good at getting a grant here and a donation there, and you know, these are public schools, and so I don't want to start going on about war, but basically, you know, there's plenty of money for the drones, but there's not enough money for kids. And I think, you know, we don't have to convince. We have those kids, you know, 6 hours every day in the government's care, and if we just had PE right there, bam, done. Problem solved. And if you get a good habit and you enjoy it, I mean, that's what I always tell people. That's the key to having an exercise program. You have to enjoy it. And for me, it used to be I went to the gym to see all my friends, you know, and then it was a social thing. And then I would get my exercise while I was doing it, but it's got to be fun. And speaking of our First Lady, there's a program that she designed called Communities Putting Prevention to Work. And our Dr. Lauren Pang and also the health officer, state health officer for Kauai got together, and they got a $3.5 million grant for Communities Putting Prevention to Work, and I was on the leadership committee for that.
Oh, wow.
And what they did here on Maui is they teamed up with Community Work Day, because the idea was they didn't want to get the low-hanging fruit, meaning the people that would be prone to exercise anyway. They wanted to get the people who it's not part of their lifestyle, it's not part of their family's lifestyle. And the idea was that gardening is, you know, because of our culture here, you know, of our very nature-connected host culture here, gardening is part of that. And so that's what they've been doing. You know, a lot of the, they're promoting it in the schools, at the Kahale Akeola, our homeless resource center. So bringing a lot of gardening in. And then one of the things we're working on is how to get the schools to allow that food to be eaten in the cafeteria. Now I'm going off into another whole show. I already did this show. But anyway, so back to how this affects care. And what would be the possibility of bringing more natural medicine into the system that you spoke of, the Maui Memorial, Kula, and Hale Makua?
Well, already, you know, we have acupuncturists and massage therapists, but you know, I think we still are a high. Well, nursing homes are probably one of the most highly regulated medical sectors. I often say that long-term care is the most regulated industry below nuclear power.
Is that true?
Yeah, because we've got regulations that are like this. And so anybody that, you know, is admitted to a nursing home has to be under the care of a physician. They can't be under the care of a naturopath or an acupuncturist.
Really?
They actually have to have a physician. You can't come out of the hospital to a nursing home for even rehabilitation. So I don't have much faith that that's going to change in the near future. But there are other practitioners that we allow to come into the homes, just like you would in your own. And so and we do have I think there is a real focus on nutrition. Dietitians are involved in planning the meals and that sort of thing. So you know, I think we have really healthy food in the nursing home.
Okay, that's good.
Yeah, because it's homemade.
Yeah. Yeah, that makes a difference. And then when you say, well, there's regulations, well, regulations are laws, and laws are made at the legislature. And
unfortunately, these laws are made in Congress, and they're parts of there's not much that the state can do to modify.
Okay, so you're saying there's a lot of federal regulation.
I think for hospitals and nursing homes, that's federal policy and federal regulation that's driven. So.
And from what I've seen, those kind of laws are going in the wrong direction. I've seen a lot of, like the laws that are supposed to be protecting the consumer are actually harming small farms. They're harming, you know, people wanting to use. They're kind of narrowing the scope and taking it away from the naturals at the federal level. So I think that's something that, you know, maybe our new Congress, whoever gets into Congress, our new person will try to help with that. But that's definitely a structural problem that I would hope at some point we can shift.
I think one of the movements, though, not that I'm a big fan of McDonald's, but even McDonald's is starting to get hip in the sense that they're offering fruit and lower, and they're offering milk instead of to kids with their Happy Meals and that sort of thing.
Okay.
In nursing homes, the federal government has finally gotten hip to the notion that we should create more home-like environments, which is a challenge in buildings that are over 40 years old and that were built like to model after hospitals. But the regulations are actually creating incentives for us to create more home-like environments. And I think so there's a shift away from the medical more towards health and community within nursing homes. So I'm excited about that.
Well, good. I'm glad that there's some of these new regulations or things that you can use in a good way to improve things.
That's right.
So we're hoping to get the video from Kalama Heights at some point. So you said, Thomas, that you're actually here on vacation.
Correct.
Or is it a vacation or a foray, a reconnaissance?
Right. It is both things. As you mentioned, I recently left my position at Kaiser, and it had been many years before I'd been to Hawaii, and I thought I would come. I'm a kite surfer. And so, speaking of exercise, and so I decided that I would come here. And the other reason is I knew that in Oahu, 2 of the public hospitals had closed. Having worked at Kaiser, there's a pretty strong Kaiser presence in Hawaii, and met with folks here and interested in exploring what care looks like here. One of the I think one of the challenges currently is that if healthcare is broken, it's broken everywhere.
Yeah, it's systemic.
Now, there's pockets of excellence.
You can always find,
but I think one of the things that, as I've explored and have started to look at Hawaii and the healthcare system here, I think you have an advantage.
Okay.
And I think the advantage is sort of the aloha spirit.
Oh, good.
It's
I'm glad you've seen that.
relationship. I think that my experience, and I've tried to get out of the touristy areas and spend most of my time actually in the community with locals, and I feel the kind of interaction between people, the relationships set it apart from the mainland. And I think that in particular in health, health is not only related, I think, to food and to exercise, but also to community.
It's true.
And as we try to figure out what the system's problems are, I think there's a real opportunity in Hawaii to really lead the nation and say that as we over the next many years try to solve the larger systemic issues, that we work on this together.
Yeah.
And that we find ways to talk about this, no matter what your politics are, that we find ways to talk about what it means to have health, and a health care system as opposed to a sick care system.
Exactly, exactly. And I think you kind of highlighted at the very beginning that the key is communication. I mean, the key in pretty much anything in life is communication, and empowering the workers in the system to say what's going to make us feel the most enthusiastic about our job. You know, it's not just, you know, wages and benefits. Those are important, and it's important that those are good, but it's also important that people feel somehow invested in what's happening, and that they feel like if they see something that's not working, that they can go to someone, go to their superior and say, hey, you know, if we did this and this, and that's listened to. That it's not like, no, that's how we're going to do it, but that people can have a say. And I think then people, they just get more enthusiastic, and then they work harder, and everybody gets better care, et cetera.
Right. Yeah, and I think one of the opportunities for the healthcare system is to take better care of itself.
Yeah.
Right. So in fact, I would argue that I'm glad to hear that in nursing homes and long-term care, the food is better. And I don't know about the hospitals here, but certainly some of the hospitals on the mainland, if you go to a cafeteria and you look at the junk food, I would say let's start with actually looking at our own cafeterias in the hospital.
Absolutely.
And what would it look like to have really amazing food? And you know, what would it look like if we actually had top-notch food, really good, healthy food, where people wanted to come to hospitals to eat our good food?
Absolutely.
What would it look like to have really top-notch gyms that are really cool with you know, the kind of environment where people want to spend time sort of exercising? What would it look like if we started our day in our healthcare system with morning exercises or stretches?
Right.
In some of the parts of Kaiser, in the Labor Management Partnership, for example, they now, when there's longer meetings than an hour, they actually have a stretch break, and they literally get up together and stretch.
That's a good idea.
So I think that again, taking better care of the healthcare providers is from what I've seen, a definitive need going forward, not to talk of even the larger problems in terms of how we take better care of our members and patients. And then lastly, to your point about being more holistic, you know, good health food and sort of good exercise has been around for a long time. And I think what we've learned is that we're still not very good at holistic care. We're still a better sick care system than a healthcare system. And we got to have a better dialogue, and if it means having a federal conversation around regulations, we do need to create access and give people choice. Give people the choice to be able to say, I want to go to a traditional physician or a naturopathic doctor or an acupuncturist, and create that choice.
And I think that's the point about choice, is that you're saying that right now the federal regulation is that they can't have those doctors, or that's just a point in insurance in general, is that insurance doesn't, like when I worked at the legislature as an aide and they offered me health insurance, and I looked and I looked and I finally called and I said, so can't I see a naturopathic doctor? And they say, no, that's not part of this plan. And you know, to me, that was a shame. I don't know if we're going to see the Kalama Heights video tonight.
Ah.
Aloha, this is Netra Halperin with Netra's News, and here we are at Kalama Heights Retirement Home. And we're going to meet some of the residents and see their views on living at Kalama Heights, long-term care, our healthcare system, and many other topics.
I'm not demanding care at the moment, but if I need it, it's here for me to have from Partners in Care, who is in our building, and there's also outside services that I could engage if I feel the necessity for it. In my situation, I don't need that yet. I may come to it, and if the time comes, I'll be taken well care of here.
That improves your quality of life right now, that you can enjoy this time of good health and know that should you need health care, it's right there. And to me, that's a peace of mind is worth a lot. Is worth a lot.
Absolutely, yes. I have a daughter close by, and she's helps me by coming to see me.
Yeah, of course.
I have good friends here. It's been nice. I'm a people-conscious person.
Yeah.
And I have very good neighbors. It's very pleasant.
Wonderful.
I welcome the opportunity to express myself, frankly.
Well,
I'm not a bashful person.
Well, and that's what Netra's News is all about, is giving people the opportunity to express themselves.
Sure. All a matter of free speech.
You got it. That's what Akaku Olelo Community Television is all about, free speech. It's the First Amendment right, and one of the most dear things of our country is free speech.
Absolutely. I'm a definite believer in it. I say what I think.
Well, you got to. Nobody's going to say it for you. Okay, well, thank you so much for participating in Netra's News.
Thank you very much, Miss. It's nice talking with you.
You look like a kind of a younger resident here.
I'd like to think so.
And what brings you here to Kalama Heights?
Unfortunately, it's a retirement for me.
Yeah.
And going through 9 surgeries.
Oh.
I've been forced to retire.
Yeah.
And this facility, Kalama Heights, is very accommodating for someone with my needs.
Excellent.
There isn't anything better that you can get when you have a bad back.
Yeah.
And I have a lot of brothers and sisters, and my mother's still alive. But then you're forced to, ask them for help, and it's not always that situation that you're looking for when you're getting older in life. You don't really want to go around asking your relatives to help you make your bed or, clean your bathroom. I moved here because my son lives here, and so I decided to retire in Maui, and I'm actually returning from when I lived here in the 70s. So it gives me an opportunity to come back to Maui and enjoy some of the beauties that Maui has to offer, the beaches and certain, obviously I'm not surfing anymore, but those were certain things that I always enjoyed about Hawaii and Maui in general, sailing and surfing and diving, and those are beautiful things that they have to offer. Kalama Heights offers the swimming pool and easy
good exercise,
easy walking to the beach, and I think in the long run, for me, it's just the place to be.
And I just wanted to mention, there is actually one resident here who declined to be interviewed because it was too windy and he had to go windsurfing. And this gentleman, I think, goes windsurfing pretty much every day. Just so people know that there's many levels of ability here. So there are people who are out there doing the hardcore extreme sports.
He's one of the fortunate ones.
Yes, yes. Do you have anything to say about health insurance in this country?
I think what's happened is we've lost track of certain, say like healthcare as a business. I don't think that it should be a business. I really don't. And
I agree.
I think that that's where we've gotten lost. I believe it's the greed that's really bringing down our entire system that a lot of us work hard to do. You mentioned a 30%. I think
of the healthcare dollar going to insurance companies.
Yeah, I don't feel that healthcare should be a bottom line or be about bottom line profit.
Absolutely.
I think that that's what's going to really bring down the whole system. As far as people were talking about Medicare as a sort of a white elephant, that it's gotten so out of control with greed.
Yeah.
You know, people doing a lot of deceptive things and making the individual that worked hard for his Medicare is making it harder on that individual. I find that every day as a individual needing more care for my back, trying to find alternative cares. You hear about things in Germany. I just saw it on the Golf Channel about how the golfers were going to Germany for back treatment. I didn't hear about any of that in the days that I spent trying to, you know, cure a bad back. Nobody mentioned things that are, say, alternative medicines.
Yeah, and that's what we need.
I don't think there's enough money in it for people, and that's where it gets very...
And you are correct. Tell me, how old are you? I know I know that's not a question you ask a lady, but...
100.
100. Well, that is very impressive. So let's see, 100, that means you were born in around 1912. 1912. And tell me, has the world changed in the last 100 years?
Oh, yes, 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 yes.
Yes?
Yes, indeed.
Yes, yes. And tell me, what have you specifically noticed?
Well, I want the young people to take the good points from the older people, and the older people to plod along and get finished what they're doing. I hope everybody works hard to keep the country on the up and up.
Work hard to keep our country on the up and up.
That's what we need.
Good advice. And what should the old people do? Should the old people mentor the young people, give them encouragement and advice and support?
But now, just when I turned it on at 7:30, they had a program going on, and the coloring was beautiful. They had, I guess, pears and all sorts of fruits, and everything colorful, so that it was just glittery.
You know, I can see that you're a person that likes bright colors. And I mean, you just look so, I don't know, Eastery or summery. Your outfit is just very refreshing.
I was a school teacher.
You were a school
That explains
teacher.
it, doesn't it?
Oh, so you like to work with children, and children like things bright. So you kind of, part of your mind is still back 5, 6, 7 years old.
Yes.
Yes.
And I had an older sister, 2 older sisters, and I tried to follow them and a lot of their way and behave myself as much as I could.
Well, now those days are over. No, don't even bother to behave yourself at this point. I think you've passed the point where it's required.
Yeah.
We have her daughter-in-law here. What do you feel about her health care and her long-term care? Is that being provided for?
Well, she came here 6 years ago, and she didn't have a whole lot of health care needs. She needed the retirement home for the stability and the socialization and the good meals and just the continuity. And so that was really nice, and we were really feeling secure that they have 24-hour nurse on call,
Duty.
24
yeah,
hours.
in case
That's
something
important.
comes up. Yeah.
But through the years, she's been here 6 years, her needs have changed.
Right.
And more recently, she's starting to need 24/7 care, so she
Right.
needs round-the-clock care. And I feel in our country it's really lacking. We're having a
Yeah.
really difficult time because the family's filling in.
Yeah.
I'm taking my turn now, but it's really hard on us to be here for 24/7
Yeah.
for weeks at a time. It's hard
Yeah.
for the families we leave at home for our lives. And if she were to get it through what's offered in the care system, we couldn't afford it.
Yeah.
It's not affordable. So
Right,
that's my
right.
concern. I don't feel it's affordable.
Okay.
She's lived a long life and she deserves the care.
Absolutely.
But where do you get it? So, as family, we're trying to step up, but it's taking a toll.
Taking a toll.
And I
yeah.
think we should have more respect for our 100-year-olds and,
Absolutely.
take some time to figure out, what could be done. To me, that's really important.
Right. And how healthcare intersects with the political realm. What do you feel about single-payer healthcare, where the program is administered through a government program, though actually provided through private doctors and clinics?
Oh, I'm a little mixed on that. I really don't want it to just be in the hands of the government. I really
Okay.
feel we need free choice, and there should be lots of choices, affordable, and each situation's so different. I don't want it set up where everyone's treated the same.
From what I've read, the single payer isn't about that everybody gets the same health care.
Mm-hmm.
It's more cutting out the insurance companies, because
Yes,
now they're taking
cut them out.
30%. Did you know that 30% of our health care dollar actually goes to insurance companies?
No, I didn't really realize
Yeah,
that.
so it's exorbitant. It used to be 3-4%, something reasonable, but now it's out of control. So the idea is to have one agency, one nonprofit agency, and the government. It would, of course, we need to make sure it was run properly, handle the cost and the distribution, but the actual providers would be of your choice. It'd be the doctors of your choice, the clinics of your choice, the retirement homes of your choice, and it would be just that you would get that through, you'd get a certain credits. So would you approve of that? Do you think that would help your family?
From what you're saying, it sounds like a good system.
Yeah.
It sounds a little difficult to set up from where we are today to get that all set up.
Yeah.
But I am for a change.
And actually, United States is the only industrialized country in the world that it has a wholly for-profit system where, I mean, frankly, our healthcare system is more about money than it is about health.
And isn't that sad? I mean,
it's very sad.
It really is
you know,
sad.
as she was saying, all the hard work all the Americans have done to
Right.
make this a great country, somehow things have gone a little askew, and I think that's
or a lot.
a lot.
Yeah.
Well, I'm trying to be polite. And I think that's what us young people, it's up to us to do, is to put it on the right track and use and build on that foundation of, you know, all the hardworking Americans before us.
Okay, well, let's look into that more and work on it. And
Okay.
see what we can do, because there's going to be more and more people living older and older.
Absolutely.
So we have to address it.
Absolutely. And right here in Kihei, Kihei, Wele, McKenna, this is, you know, a retirement community
a lot
for
of us
many
baby
people.
boomers are here,
The baby
right?
boomers, and then did your mother-in-law come here because you and your husband lived here in Hawaii?
Yes,
Right.
And she has one of her sons on this island. We're from the Big Island, and
Okay.
her daughter's from California.
Okay.
But definitely that was a big part of it with weather.
Right, right, and that's what I was having lunch here at Kalama Heights, and the residents I was sitting with said that most of them are here because one of their kids lives on Maui and said, okay, come on out here, and you know, then I can visit you on a frequent basis. So.
And before we close, I would like to mention that Kalama Heights really has a lot to offer, and that's why
Okay.
we chose it. When Ruth first came, she swam every day in the pool, walked
Wow.
down to the ocean, and
Yeah.
even now I take her in the wheelchair down to the ocean.
Yeah.
The setting is family. It just feels like family, and they sit down for meals, and they have fresh fruit and vegetables and
Yeah.
homemade bread. There's lots of activities. They have karaoke, which Ruth was singing yesterday, Our Blue Sky. And they offer just numerous activities and friendships. And her best friend is here, and she's 101.
Oh, okay. Well, wonderful. So all of you who are anywhere under that, and if you think you're old, then you're not.
Right.
Well, so, I mean, if you're 50, you like around 50 my age. I've only lived half my life, so I'm just getting going. So.
Well, thank you for caring. We need more people like you that care.
Well, you're very welcome. Thank you so much.
Thank you.
Thank you. Thank you.
Thank you.
My neighbor Catherine, she's legally blind, and if somebody could read to her, because right now I read the menu for her, and one of the girls downstairs reads her mail. But if somebody would come in maybe on a weekly basis just to read to her and give her some insight, like reading the newspaper. She can't read that. And there are other people that probably have other problems that could use a volunteer, because there's so many people walk around with walkers and within wheelchairs that need additional help of one kind or another. So that's my suggestion.
And if the public would like, somebody in the public would like to come, what should they do?
They should contact Kalama Heights, and Kalama Heights would make a setup that they would probably be registered as volunteers, and then they'd go from there, telling us what their forte is, what their ability is.
And should they call and ask for Suzanne?
Yeah.
And ask for Suzanne, and I'm sure she'd be very happy to get people volunteering, young, old, any retired, anybody who has time. I think adopt a grandparent, whatever, adopt a parent. I think it's an excellent idea.
Okay.
Thank you.
Thank you.
So we're coming towards the end of the show. So each of you get to talk to the audience and say, what would you like? What would you like? So Tony, what would you like from the mostly Maui audience?
I guess I want people to know that the hospital in Hale Makua and Kula are working, as I've said, together to try to improve care on Maui, to try to move towards coordinated care, and that we hope to work with the physician groups to, because the physicians are very much a part of the system, and that we look forward to talking about how we're going to do that and how the community can support us in the very near future.
Awesome. Sounds like a great plan. Thank you. So Thomas, what would you like, what would you like to tell the world?
In particular, I'll say what I'd like to tell Maui. I think the world's a big place, so for Maui, what I would like to ask all of you is to hug your care provider. So we've been talking a lot about that our healthcare doctors and our nurses and our medical assistants, all of the folks that work in our healthcare system show up with passion and they work very hard. So find people that work in your local healthcare place, whether it's in a community clinic or in a hospital system or in a nursing home, and just give them a hug and tell them that you appreciate the work that they do.
I want to thank you for coming, both of you. This has been very interesting.
Good.
Thank you for having us.
Next episode, we're going to be looking at the Filipino community and what are some of the issues, what are some of the resources. So thank you.